GQ, I know you've got a lot of friends on the land, as I have as well, are out there doing it tough at the moment.
It is enormously tough to us, and that connection that Gus talked about, we need to take some responsibility in the city as well and make some contact, share it around. But I'd like to talk about nourishing new life today, Das.
Yes, so last week we looked at how ginger and vitamin B6 can help with morning sickness. So what's on this week's pregnancy wellness menu?
We're talking today, Jo, about bones and teeth in the developing baby. So the story today is calcium. And calcium's really important. We need it for muscles, we need it for nerves, we need it for heart rhythm, and it even plays a role in the developing baby in blood clotting. So very important mineral.
Right, so how does the growing bub get the calcium? You know, the mum's eating it, the pregnant mama. Is it getting to the baby?
Actually, the baby competes, Jo, with the mum. So mums need extra calcium as well. So as soon as you eat or take some calcium, the baby is in there grabbing that, and there needs to be enough to go around, essentially. And we need to look at how much. So the experts say, on average, women need about 1,000 milligram, but in pregnancy and breastfeeding, with advice, needs to go up to 1,200 to 1,400 milligram a day because of that competition. But it gets a little more complicated because we need vitamin D as well to help with the absorption of the calcium. So there's no point taking the calcium if our body can't absorb it and use it. OK,
so calcium and vitamin D during pregnancy, do mums need it after they give birth?
They do, because remember, the baby's competing for calcium, and babies don't absorb vitamin D from their mum. They absorb D from the uterus while they're developing. So without the vitamin D, they are unable to use the calcium correctly as well. And remember, the calcium also is very important for mums because it helps keep blood pressure under control in pregnancy. It helps reduce the risk of preeclampsia, which is where things can go wrong with blood pressure and fluid retention. Yeah. And it stops leg cramps, which is a very common quality of life issue during pregnancy.
Oh, my goodness, I know that. So obviously very important. The A to Z of Vitamins is brought to you by NutriCare Pregma Plus, the only multi-stage soluble supplement to support your pregnancy journey.